Welcome to DRA's quarterly small business workshop, HR in the time of COVID, co-produced with the HR experts at CAI. This is a quarterly series that we put on here at DRA, and I know the CAI folks will talk about this as well in terms of their resources that they provide. Downtown Raleigh Alliance is the organization I work for. We're the downtown advocacy organization for Raleigh. We provide a range of services to businesses, including small business support. And you can find more information about Downtown Raleigh at downtownraleigh.org, or you can email me. I'm the Director of Economic Development and Planning at willgaskins@downtownraleigh.org. So quick housekeeping item. We will be allowing questions to be submitted throughout the presentation. And the way that you do that is through the Q&A button that you may see in your menu bar. And if you click that, you should be able to submit a question. That'll go to the moderators. And then when there's a good time to submit that in, or at the end when we have kind of live Q&A, we'll be able to answer those questions and address anything that comes up. So if you've got a question, please submit it as you get it, and then we'll try to address it either in the presentation or at the end of the presentation. So with that said, I'm going to go ahead and introduce Bree from CAI, who's going to talk a little bit more about CAI, and then we'll introduce our two panelists today.
Thanks, Will. Let me go ahead and just share my screen. Okay. All right. So let's see. Here we go. Can you guys see it? Okay, good deal. So as Will mentioned, I am Bree Steffen. I am HR Success Manager for CAI. I wanted to just give you all a little bit of background on who we are. We're so excited to be a part of this, and we want to thank the Downtown Raleigh Alliance for allowing us to be a part of it. I'm also excited that this is virtual, maybe a silver lining around our topic of COVID, that we're all able to do this from home on a rainy day. So excited to see you all here. I promise I'm not going to just read from a web page the whole time we speak, but I do want to show you this. This is, our about page, and it really sums us up. Our president, Bruce Clark, basically describes us as a nonprofit membership-based organization emphasizing long-term relationships with North Carolina employers. It's not about invoices, consulting models, or long engagements. It's about relationships and service. So that's something you'll see today in our webinar for all of you. What I want to do is today I'm going to share with you one of our greatest assets and human beings here at CAI. Linda Hunter will be working closely with Rebecca Hoovler. Linda is providing expert advice to all of our members on a day-to-day basis. She ranges from areas of employee relations, federal and state employment law compliance, and advises HR leaders on our operational and strategic human resources. So we're excited to have her today. We're also very excited to have the COO of Trophy Brewing, one of our downtown Raleigh businesses. And what I would like to do before we get started, just to have Rebecca give us a brief account of how she uses us as a member, and how she kind of already had a relationship with Linda before we actually decided to do this webinar today. So Rebecca?
Hey, Bree, thanks. Yeah, actually, we were really fortunate that we joined CAI. Wow, towards the beginning of the COVID life pandemic. It just seemed like even though we've tried really hard as a business to take HR seriously and always have policies in place, this was our first pandemic. So there was a lot to learn and a lot to try to maneuver. And I would say that the team at CAI has been unbelievably amazing, ridiculously responsive. There's been just a lot of questions that we can look up all the answers, we can try to research, but it's been wonderful to be able to have a personal connection, be able to either call or email and say, hey, this came up. We think this is what we should do, but we just want to verify. And Linda and the team there have just made it so much easier to say yes, or this is what you should do. It really helped us kind of navigate through what 2020 has been. So we've used it for COVID questions. We've also had, there's like a series of answers at 8, and we've gone to a couple of those. There was a recent equity training that we took so that we can try to make sure and just keep evolving towards the best business that we can be. We even had CAI review our current handbook that we have for all of our employees to make sure our company practices are the best they can be. So it's been a wonderful experience. So I'm really happy to be here and help with this today.
Thanks. So I'm just going to turn it over to both of you. The idea here is to go over HR concerns and considerations that you all have seen through COVID. And then at the end, you guys will open up for a Q&A. We've already collected some questions from registrants today, so hopefully we'll hit all bases and help everybody who has joined today.
Bree, thank you so much. I'll go ahead and get us started, but let me also just reiterate our thanks to Will and to the Downtown Raleigh Alliance for allowing us to be part of this. And a big thanks to Rebecca for partnering with us on this as well. Rebecca, since you are a downtown business, it's just perfect that you're part of this. So I know that deciding to close or maybe being forced to close and then going through a reopening of your business and operating any type of business in the time of COVID has been challenging and continues to be challenging. So I'm hoping you can get us started by maybe describing a little bit of how your experience has been and how you've reacted to it.
Yeah, sure. We, like so many others, kind of had to roll with the punches with this. You kind of saw some of it coming, you try to stay ahead of it, and then it just hit. So I think that this has just been the year of all years. So we have 4 locations. We had a restaurant downtown, we had a bottle shop, a production brewery with a tap room, and then a restaurant a little bit out of downtown. So with that setup in our business, we've run into every single scenario that restaurants and hospitality have run into at this point. Maybe not, but it feels like that. When COVID first hit, we had to furlough 102 of our 122 employees. And I'm not going to lie, that was absolutely the hardest week of our professional lives. One of our locations downtown did fall to the side of many others, and it's been closed since March 17th that week. We just didn't have a good option for curbside. We didn't have accessible outside seating. And with all the other factors in play, we have had to close one location. The others, we had to actually just trim down to management level, and our managers helped us stay afloat. We were on, just online ordering, and it pretty much felt like the hammer dropped and we were running a skeleton crew at that point. So we did actually luckily join CAI during the pandemic, probably within a month or so, to help us understand what those best decisions were for us as a company and how to pivot to what we call the new normal that we're experiencing. It was incredibly hard to look at it, business versus personal and interpersonal relationships with our incredible employees. We've been really fortunate to have a lot of people with us for a while. And so we had to look at all sides of the spectrum and how do we stay afloat as a business and how do we keep going so that we have a business for employees to come back to. So, we were constantly on the DES website. I personally was checking it probably 3 times a day to make sure I was responding as quick as possible so that I knew our employees weren't waiting on us to get unemployment. We were helping them set up accounts if needed, if they couldn't figure out how to. We set up a Pay It Forward campaign. Our owners were working with local charities and local food distributors so that we could have employee boxes for people that were in our staff affected, as well as pickup boxes at our production brewery for pretty much anyone affected. And, when it came to trying to understand how COVID would affect us, intimately, it wasn't like a weekly meeting talking point. This was literally all day long, a text thread with the partners of what can we do? You know, how do we switch to online ordering? How do we do this quickly and efficiently? How do we make sure it's contactless service and keeping our staff and our guests as safe as possible? How do we update our policies and procedures so that we're operating at the best capacity for our internal staff? How are we handling guest situations that might arise? Do we have enough PPE on hand? Do we have vendors we can work with to get masks, gloves, hand sanitizer? Can we make sure it's refilled? How do we get thermometers when they're out of stock? Who do we hire for weekly disinfection? Because that was definitely not something we had before. The list goes on. And I think, you know, at this point, I would say almost everybody on this call probably has had all of these conversations. And I think this today is in perfect timing with everything exploding again. You know, we have luckily been able to bring back some of our staff. Since in July, we started doing some on-site patio seating and service at our 3 existing remaining locations right now. But we're still only at about 50 total employees. So we're still at less than half of what we had before COVID hit.
Wow, Rebecca, I am really sorry to hear that. I can't imagine what it's like to be in the seat where you're the one actually having to get rid of 90 or 95% of your staff. That's really, really difficult. Unfortunately, it's the same story almost everywhere. So I really do joke, but it's not really a joke, that I feel like we all went to bed one night and we woke up the next morning and our world was literally turned upside down. So from our perspective here at CAI, you know, our members were turning to us for answers almost overnight. And quite frankly, they were answers that we didn't have. We spent most of our evenings in the beginning really doing a lot of research and developing tools that could really help North Carolina employers kind of get through this. So I probably know more about the layoff process in North Carolina and every federal program out there than I ever thought I ever would have to know in my professional life. You know, we also had to do things like help employers come up with reopening protocols and creating processes and policies and templates. And really one of the hardest things was explaining to the employers why that was necessary. We knew that having all of this in place was going to be an employer's best defense in any type of litigation that would ensue. And we knew eventually litigation was going to happen, and we have seen that. So OSHA, which is the Occupational Safety and Hazard Act, has a general duty clause. And that clause basically requires employers to provide a workplace that's reasonably safe. So we had to really help employers figure out how COVID fit into that and what did that really mean. If an employee or even a customer were to call the DOL and make a complaint that you did not have a safe workplace, then OSHA is going to come knocking at your door to investigate that. And I promise you, that is not what you want to have happen. Once they do that, they get into much more than just your COVID response. So having good policies is really important. And we have been able to build some pretty comprehensive toolkits that can be downloaded and adopted with really very little effort on the part of the employer. And at the end of this presentation today, we'll share that link so where you can get all those tools, because it is something that you all will have access to. So if you're a company that doesn't have something in place, we really suggest that you do that as soon as possible. So what we really want to do with the rest of our time is talk about some real world scenarios and issues that you are probably experiencing. Rebecca, I know on behalf of a lot of businesses, you've got some really good questions that you'd like to ask. And again, as Will mentioned, if you've got questions coming in during the call, just use that Q&A feature and we'll try to get to those as well. So Rebecca, what's on your mind and what's on the mind of employers these days?
Yeah, so Linda, I think the first question is what every single person is going to ask if they haven't already. What should an employer do if they have someone that says they have COVID?
That says they have COVID, right. So that is probably one of our more straightforward scenarios. So what we would recommend is that the employer excuse that employee from the workplace for 10 days, measured forward from the date the symptoms began, or if there were no symptoms, from the date that the test was administered. And if for some reason an employee does not want to get tested, then you need to kind of treat them as presumed positive and follow that same time frame. So from the date that they had that exposure.
Got it.
Or the date that, I'm sorry, the date that their symptoms started. So
Okay,
again, the important thing there is 10 days.
That makes sense. So can the employer require that they take a negative test before they return to work?
Yeah, so they can. There's a couple of things to know about that, though. One, the employer would need to pay for that test. And two, employers need to understand that the test is only going to measure a certain point in time as of the date of that test. So it's not going to tell you, so it may tell you that they're negative today, but it's not necessarily going to mean that they're negative tomorrow. So should keep that in mind.
Okay. So what about like pay? Do employees get paid for the time they're out?
Yeah, so that's a great question. And that's another one that kind of has a, it depends quality to it. So if you are under 500 employees, which probably most of you on this call are, then the FFCRA, which stands for the Families First Coronavirus Response Act, but you're going to hear me refer to it as the FFCRA throughout this call. The FFCRA mandates that employers give employees up to 80 hours of emergency paid sick time that can be used for either their own COVID illness or if they need to care for a member of their household that has COVID. So if it's their own COVID illness, which is what we've been talking about, and they are seeking a diagnosis from a medical professional, and that can be a testing site, a doctor, or even the DHHS, then that 80 hours for full-time employees is paid at 100% of their pay. If it is for the care of another, so let's say it's somebody in their household, whether that be a roommate, a spouse, a child that has COVID, then it's paid at 2/3 of their pay. But you need to keep a couple of things in mind. It can never be less than minimum wage, which in North Carolina currently still is the $7.25 an hour. And all of this time, although the employer is paying for it, does come back to the employer in the form of a tax credit when you file your quarterly 941 reports. So in this example, the employee would be paid as long as they are under a doctor's care or they're seeking a diagnosis such as getting a test.
Okay.
We did have a question that came up regarding this, regarding tips. So how would you figure pay for an employee that is a tipped employee? So what you do is you would go back 6 months or whatever time frame makes sense. Maybe you haven't been working in the past 6 months, so whatever time makes sense. And you would look at all of their wages. So their hourly wages plus their tips that they reported, and then divide that by the number of hours they worked to come up with an average rate of pay. Again, keeping in mind that it can never be under $7.25 an hour. And that's what you would use for their 100% pay. And then again, that's what you would use as the basis to reduce them to the 2/3 pay. Hopefully that makes sense.
Yeah, definitely. So that time, is it in addition to any time that like you as an employer may want to provide on your own?
Yes, and that's a really important distinction. It is in addition. So it doesn't replace any sick time, vacation, or PTO that you as an employer are providing. And it's up to the employee to tell you that this is the time that they would want to use instead of their sick vacation or PTO. But if they do use the time under the FFCRA, then they still have that time in those banks.
Got it. So what about if you have an employee that says they've been in contact with somebody that tests positive for COVID?
Yes, those are probably our favorite scenarios. And again, there's some element of that kind of depends, but in general, the first thing an employer needs to do is make sure that that contact is really close personal contact. So currently, that is defined by the CDC as being within 6 feet of someone who's positive for at least a cumulative 15 minutes over the past 24 hours. So anything less than that is not defined by the CDC as close contact. So if Rebecca, you and I were working together and we passed one time in the hallway and chatted for 5 minutes, that's not considered close contact. But if we did that 3 times throughout the day, then that would be considered close contact by the current CDC definitions. And another question that we get in regards to close contact is, does wearing mask negate that? And the answer is no. So we're all encouraged to wear masks, and it is also, a law of the land right now, at least in North Carolina. But wearing a mask does not mean that you can be within 6 feet for more than 15 minutes and have it not considered close personal contact. So if you have decided that, yes, this was close personal contact, then CAI recommends the quarantine strategy. And really what that means is that that employee should be quarantined from the workplace for 14 days, measured forward from the first date of contact.
Okay, so just want to clarify. So if I have COVID, I stay out for 10 days. But if I come in contact with somebody that has COVID, I stay out for 14 days. And if so, what's the difference there?
Yeah, great. We get that question all the time, Rebecca. So the course of the actual illness, when you're sick and when it's scientifically reasonable that you can pass that virus to someone else, is 10 days. But the incubation period for the disease is 14 days. So if you've been exposed to someone, you have a 14-day window where you could potentially develop that virus. But if you have the virus, you should be through it within 10 days. And I've got a good way to kind of explain this. I heard on the news this morning that there was a cruise ship that started cruising and somebody on the ship tested positive for COVID while on the ship. Well, how could that happen if the cruise ship tested everybody before they got on the ship and everybody tested negative? Well, it could be because somebody was in a 14-day period where they had knowingly or unknowingly come into contact with someone who was positive. And so they were within that incubation period. And while on the ship, the virus developed. So hopefully that helps make that point a little bit clearer. So you can take a test on day 2 of contact and be negative, but doesn't mean you're going to still be negative on day 5.
Got it. So what I got there is don't take a cruise. But so what about
Probably not
pay?
yet.
I'm not in the mood yet. So what about pay? Do these employees get paid too?
Yes, but only if the quarantine was mandated by a healthcare provider.
Okay.
So if, and again, that healthcare provider doesn't have to be their own. It can be the healthcare provider of the person who actually was sick that's saying, hey, anybody in that you've been in contact with needs to quarantine. It could be DHHS dictating that quarantine. It could even be the testing site saying, okay, we're administering this test, but you need to quarantine for X amount of time. So the important thing to kind of remember here is that the employer can excuse these folks from the workplace and does not have to provide any pay. So it's okay for an employer to say, you need to quarantine. The employer is not a healthcare provider, so they can't sanction pay under FFCRA. What most of the time can happen is the employee calls their doctor, the doctor agrees that they should quarantine, and then the FFCRA would apply.
Okay, got it. So is there any kind of specific documentation or certification that they need to get from the doctor?
So that is another great question, and there is not. So when this was first introduced, the thought was that doctors were going to be so overrun with patient care that they weren't going to have time to fill out paperwork. So this was really designed to be a self-reported system by the employee. So the employee only needs to provide the doctor's name and the date they were told to quarantine. There's also no specific form that the DOL has issued that has to be used. However, for our members and non-members, CAI has created one to make that easier, and you can all get that from our website. You would just provide that to the employee. They would fill it out. They would return it to you, and then you would pay them. Your only obligation as an employer is to keep this on file for 4 years. And you need to make sure you're not keeping it with their regular employee files. It does need to be kept in a separate medical file. In the event of an audit down the road, if there's any questions of the validity as to whether the employee really did get this from a doctor, that's going to be between the employee and the doctor. The employer is really out of it at that point. Your only obligation is to collect whatever the employee has self-reported.
Okay.
Great question.
That makes sense. Okay, so this is kind of like a 6 degrees of separation from Kevin Bacon idea, but what about employees that say they've been in contact with somebody that's been in contact with a COVID case? So like a contact of a contact. Do those employees need to be sent home? Like what's the idea there?
Right. So I like to explain this. I'm kind of going back to we're all separated by 6 degrees of separation. And the employer is only responsible for that first degree. So if you've got somebody that's been in contact with someone who is positive or presumed positive, then the employee needs to quarantine. But if they've been in contact with someone who has been in contact with someone else, then you don't need to go that far. So it's just that 1 degree. So no contacts of contacts in most cases would need to be quarantined.
Got it. So this is a little bit different from that one, but what about like employees that need to take time off because school's closed or their kids are virtual? So, mom or dad duties pretty much. Does an employer like have to allow this? How do you work that into your operations?
Yeah, absolutely. So that is also covered under FFCRA. So the FFCRA is really divided into 2 sections. You've got the emergency paid sick leave, and that's the 80 hours that we've been talking about, or it's 80 hours if a person is full-time. If they're part-time, then you do prorate that. But then also, other than the emergency paid sick leave, you also have the emergency family medical leave. And that is really what is meant to cover time that parents might need because their kids are not able to go to daycare or are out of school. This applies only if the employee has been employed for at least 30 days. And just go with me here for a minute, because I know this is going to be shocking if you haven't heard it before, but the employee is allowed 12 weeks off at 2/3 pay under that emergency family medical leave. The good news is that it's only truly if the school is closed for their student. So if you've got parents that are choosing a virtual option over a physical option that they have, then FFCRA does not apply. What we are seeing a lot of now are these hybrid type schedules where you go to school a couple of days a week and then a couple of days are virtual. So on those virtual days, because those schools are closed to that student, then FFCRA would apply on those days. And again, it's allowable up to 12 weeks. And it's the same scenario if daycares are closed. So we're seeing that daycares aren't so much closed anymore, but they could be closed to a particular child. Maybe that child has to quarantine for 14 days. So daycare is not an option. So the FFCRA under the emergency family medical leave would apply. There is one confusing twist to this that I want to kind of add in. Under the emergency family medical leave, those 12 weeks, the first 2 weeks is either unpaid or an employee could choose to use their own PTO, sick time, et cetera, whatever the employer allows. But there is an option that if the employee has not already exhausted their 80 hours under the emergency paid sick leave, that they could request those 2 weeks to cover the 2 weeks that would otherwise be unpaid. So I hope that's clear.
Yeah, okay. That makes sense. It's a lot to digest, but that makes sense.
It is.
And that is definitely a lot of time off, not gonna lie. So, you know, I would say, knowing our community, I could see some small businesses maybe not being able to make that, not being able to allow it even. Is there anything that they can do?
So there is something in the entire FFCRA law called a small business exemption. If you are an employer and you are under 50 employees, you could opt out of having to provide that time if one of the following 3 items is true. So the first one is if fronting that money for you would result in obligations that exceed your available business revenue and could cause your business to cease operating at a minimal capacity. So in other words, you really just don't have the money in the coffers to be able to front this money. So you know you're going to get it back, but you still have to pay it out upfront. Or the absence of that employee would entail a substantial risk to the financial health of the organization because of that person's specialized skill or knowledge. So let's say it's, I don't know, Rebecca, the CEO. Without your specialized skill and knowledge, the financial health of your organization could be at risk. So that could be a reason why it would not apply to you. Or the third area is that there would not be enough workers who are ready, willing, and able to work that function to keep the business operating at a minimal level. So, if you think about servers, if, you've got all of your servers out and you don't have enough workers that could keep the business, who could do that job of serving, to keep the business operating, then you could exempt yourself from the FFCRA law. What would have to happen is that an authorized representative of the business would have to attest to one of those 3 reasons and just keep that on records again in the event of an audit. And that piece is probably really important, Rebecca, because you undoubtedly will have unhappy employees who will call the DOL and say, my business isn't paying me. And then the DOL is going to call you and say, hey, why aren't you paying anyone? And so you need to kind of keep that attestation for your record so you can provide it to them when asked. You do not need to do anything upfront.
Got it.
Good. So it looks like we've got a couple of questions. So maybe now is a good time to pivot into answering some of those. I know one of them was around mandating testing, and can an employer require testing for employees? And the answer to that is yes, you can. The EEOC, the Equal Opportunity Commission, is the body that has not mandated, but said that it is acceptable for you to require testing. As employers, you know, most of the time you cannot go into medical issues with your employees in that manner, but you can do testing. I just want to caution the employers to understand that even though you're requiring testing, you're only measuring that point in time, as we talked about before. So it may or may not make sense for you to require that. Another question that we had was, you know, it was around employees getting more than 1 bucket of this 80 hours of emergency paid sick leave. So to be really clear, no, it's 1 bucket of 80 hours. And once they use it, they do not get a second shot at it. Now, it is 80 hours. So if the first time they only used 40 hours, and then they want to come back around and use the other 40 hours for maybe a second exposure or a second testing that they need to go through later, then that's okay. But it is 80 hours for the year. And by the way, all of this, the emergency paid sick leave and the emergency family medical leave, is set to expire on 12/31 of this year. We have not gotten word that it will be extended. However, I think that there's some good indication that it may be in effect for next year as well. But as of right now, 12/31. So the exact scenario I think that was presented was that an employee has symptoms, tested negative, but used all their 80 hours. So maybe this was back in the beginning when it really did take 2 weeks to get test results back. So they used all their 80 hours. Then 3 months later, they have symptoms again, and they have to be out. The employer is requiring them to be out. They do not get a new bucket of time if they've used that 80 hours. One of the few areas where an employer has a little bit of say in all of this is around intermittent use of the time. So let's say you've got an employee who maybe only needs to be off for 2 days a week. Maybe they can work virtually, let's say 3 days a week, and then they need to be off for 2 days a week. You as the employer get to decide if you're going to allow intermittent use of the time. So hopefully that helps. And also, you as an employer get to decide if you want to supplement any time that's paid at 2/3. So again, if it's emergency paid sick leave for a member of the household that has COVID, then your employee gets the 2/3 pay. You can allow them to supplement their PTO or sick time to cover the other 1/3 if you want to. You do not have to allow that. That would be totally up to your policy that you have put in place. So a couple of other questions here. What if the employee who says they're out with COVID doesn't ask for the FFCRA pay? So if they don't ask for it, you do not need to give it to them. However, you need to make sure that they know it is available. So what you need to do is make sure you've got that poster up. And if you don't have that poster, you can get it from the DOL's website or from our website. Doc, well, I'll tell you what. Is it better, Will, for you to go through these questions and maybe throw them out to Rebecca and I? I'm sure everyone's sick of listening to me talk.
Sure. So next question, what documentation is required, if any, for return to work if an employee was in quarantine?
So required, nothing. Up to your company policy if you would like to require something. And again, that would likely be a test, and you would need to pay for that test if that was something that you want to require. Rebecca, what are you doing in terms of that as a business?
Yeah, we actually are asking employees to get tested.
Okay.
So that's something that we're asking so that we can know that we have that test, and we are asking for that result so that we can feel more comfortable to have them enter the workplace, because since our workplace isn't necessarily one that you can just work from home, you're interacting with other employees in a team environment. We just want to make sure that the whole team is kept as safe as possible.
Yeah. Yeah, good. And you're paying for those tests.
We are, yeah.
Good.
If you contract COVID and you are out of sick time, is there a way around that, or is that a separate entity entirely?
Yeah, so if you're out of time under FFCRA and you're out of sick time, then that time is unpaid. And there is no really way around that. I mean, some employers have put in place like special buckets of time to help employees through that type of scenario. But honestly, that was probably more at the beginning of COVID than where we are now, because what we're seeing is multiple exposures. So you've got employees, the same employees are out over and over again.
What if you are unsure the employee is being honest about needing to quarantine or testing positive?
Yeah, that is, that's a tough one because we all have our instincts and suspicions. What I can best say is this probably is not the time to over question anyone and err on the side of caution. I will tell you that I dealt with a member recently whose employee was up on their 5th time being out. And so that, we looked at that situation a little bit differently than if it would have been the person's 1st or 2nd time.
This one is a situation. We have one employee that had direct contact to a positive person. We had him and 4 other employees that work with him get tested and were off work until negative results came back. Do we have to pay all of these employees while off? Also, once they get their negative results, are they okay to come back to work?
So that's going to depend a lot on company policy, but there's no law that says you have to pay them. FFCRA would only come into play if they, again, were directed to quarantine by a healthcare professional. So the person or the entity that did the testing could say that they needed to quarantine, and then that would apply. And again, negative results, letting them come back to work is fine. Just remember again, and I know I sound like a broken record, but that test is only measuring the status that they were in when they tested. So if they're still in that 14-day window, they could easily bring COVID into the workplace.
Let's see, if an employee exhausts the EPSL and EFMLA contracts COVID-19, can he or she be terminated for having to miss work?
That's a great question. So we have cautioned employers to be as lenient as they possibly can with attendance policies when folks are out because of COVID. But the boiled down answer is that yes, you legally could terminate them. There are some other things that come into play there though, like the ADA. So there are some scenarios we kind of want to talk out before actually, giving an employer the green light to terminate, but it's not impossible to do that.
Okay, last one in the queue right now. We were told once they test positive, it will be a positive for 3 months. Have you heard that?
I have heard that. So it is possible that a positive person can test positive for up to 3 months, but it is very rare. So it's not, it's certainly not the norm. If you are requiring somebody to have a negative test before they come back to work, and there's somebody that falls into this category where they're continuously testing positive, then we might recommend that you have them fill out maybe either ADA paperwork for an extended leave of absence, or get a note from the doctor that indicates if they're still shedding the virus, right? Because you could potentially be positive and not shed that virus onto other people.
Okay, we have a couple more questions, but I'm
Okay.
not sure if you have other topics that you wanted to cover that we're hitting those. It's about 10:50.
No, I'm good.
Okay. Do you track normal FMLA at the same time that they are on FFCRA?
Yes, if it is for the emergency family leave, so that 12 weeks that we were talking about, that is part of FMLA. The emergency paid sick leave is not, unless they're using it to cover the first 2 weeks of the emergency family leave. So that's a great question, because if that's the case, and you do have more than 50 employees, so you are subject to FMLA, then there is paperwork that you're going to need to have somebody out. You've got to do your standard FMLA paperwork.
You may have covered this already, excuse me if so, but what if an employee is afraid to come to work because of COVID?
Right. So if they are afraid to come to work, that is not covered under FFCRA. And it is not really an excuse for someone to not work. The option at that point is to accept their voluntary resignation, because that's in a sense what they're doing. And they can then apply for unemployment that may or may not apply to that particular situation. One of the things I will say about that, though, Will, is that an employer really should find out why the person is afraid to come to work, because maybe you can reassure them through your safety protocols and all the policies and practices that you've put in place that would help alleviate some of those fears.
Rebecca, do you have anything that you would want to add to that?
Yeah, all I was going to say is we actually did run into some of that in, the July time period when we were bringing back some staff. And we actually had some one-on-ones and virtual meetings with some people before they were on site. And some people did come on site, but it was, distance with masks on to have the conversation. And we just mapped out exactly our plan so that they could feel more comfortable, ask any questions they had, because I'm sure things were just in their head and they were getting worried, especially when you've been away from everyone else to enter the workplace again. But that's all we did, was just try to say, this is everything we're doing to keep you safe. We're, you know, not allowing inside seating, we're having sanitizer, we're having this and that. And luckily, every single employee that we asked to come back did. So.
Great. Just a general question about best practices for internal pandemic response teams.
Yeah, so I think maybe what that question is really around is, who are the best people in your organization to put onto a team like that to help you get all of your safety protocols in place, and your policies and practices, temperature taking if you're doing that, those types of things. And there's no prescribed answer. It really depends on your organization and who you have. It really can be anyone. No special training is necessarily needed. So really is very specific to the employer. But of course, if you're a member of CAI, we can partner with you and help you figure all of that out.
Rebecca,
do you guys have a response team?
Yeah, so I was actually going to say, we did definitely reach out to CAI for some guidance when we were setting up our new policies. We pretty much added a pandemic addendum to our current policies, as well as just enhancing normal operations. And then honestly, our owners, partners, they kind of have a constant conversation, and we include the tiers of management. And every single week in manager meetings, we review anything that can come up so that anyone in any level can actually bring it to us. So there's kind of a central, I guess you would say, command center of decision makers. But we want to try to keep it as open as possible so anyone at any level can bring the questions, so that we can make sure we're alleviating any concerns and also addressing new things as they come up, since every phase something's changed. So that's just kind of been how we've been doing it.
Great.
Okay, so last two questions, then I want to let Linda be able to show the link for their coronavirus response center. So just to verify, we don't have to pay even if we ask them to stay home until negative tests if they are told by a doctor.
That is correct. There's no legal reason that you would have to pay someone. Now, if they are exempt, then there could be some pay implications that would be, specific to that situation.
If an employee requests to use EPSL for past dates, do I have to go back and reclassify that time?
So the DOL is not really weighed in on that. So our recommendation is yes, there's not a place to kind of split hairs. Maybe they didn't know or didn't realize that, back in April, this was an option. So if they want to retroactively apply the time, I would allow it if they're still employed.
Okay, great. So we're going to start to wrap it up. Any final thoughts, Rebecca, and then Linda?
I would just say thank you to you, Will, to Bree for bringing me in, and Linda for being the nonstop knowledge base that we all appreciate. But I would say that to anyone that has access to the CAI people, I would definitely reach out. And then Linda's going to share their page that has a lot of information on it. I personally do look at this a lot, and I would just say that, to me, constant communication with your team and your employees is just so incredibly important this year, and just really trying to look out for everyone's best interest so that we hopefully get all of this, past us and into a healthy 2021 with a really strong team.
Yeah. Well, Rebecca, thank you so much for agreeing to do this with us. And, to all the listeners, I know this is a lot of information and it's a lot of technical information. So I did want to share with you that you can go to capital.org, and you do not have to be a member. The very top bar is our Recovery Command Center. If you click on that, you will see lots of information in these 3 vertical boxes. Don't let that overwhelm you. I'm going to point you to the bottom. If you've got questions on the FFCRA, which we have spent a lot of time talking about, click on it and go to the toolbox. And in there is a copy of a policy. It's a copy of the request and the designation form that you can use for your employees. And there's also a copy of the poster, which you'll want to make sure you've got displayed. In addition, if you, hold on, let me go back. If you also go to the safety, workplace health and safety, we have a similar toolbox, which is here, I promise. Here it is, the toolkit, the safety program. And this is going to have a bunch of policies that you could use as an employer. And again, just kind of make them your own. And one last thing, if you go to evaluating this employee COVID-19 contact cases, we have a nice little chart that kind of tells you, if this, then this, when it comes to contacts and positive cases. So again, just capital.org and that top line. And I think we're just about out of time. So hopefully you learned something, or at least have a resource to go if you have any further questions. So again, Will, thanks much for having us.
Yeah, thanks again, Will, Rebecca, Linda. I really appreciate it. I hope this was helpful for everyone. Please come to our coronavirus recovery center on our website. And if you do have any questions about membership, if you just hit the join now button, you won't be required to join. You'll just get a phone call and we'll explain to you what additional services we can give you besides the website and the webinars and the answers at 8, but we're happy to help in any way.
Thank you, Linda. Thank you, Bree from CAI, and thank you, Rebecca from Trophy. I think this has been a wonderful program. There's been a lot of detail here and there's a lot of dimension to this. So I really appreciate you taking the time to be able to walk through and give some real world examples of that. This webinar is being recorded. We're going to host it live on our website and also on YouTube. So we'll send that link out to participants and expect that either tomorrow or early Monday that would get up online. But if you have any questions, please reach out. You should all have my email address, willgaskins@downtownraleigh.org. I'm happy to pass you off to CAI or Rebecca or whoever. So thank you for joining this morning and have a great rest of the day.
Thank you.
Thank you.